Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
My super guest today is someone that you've heard before. He's been working with us for a long time. His name is John Ahlbum. And John is a person with, of course, he is the founder of the Ahlbum Insurance. And it's the company that does all the supplemental insurance. That's really what's very important. It's called United American. And so I just want to introduce you. And, of course, he's calling in from Cape Cod. That's too bad, isn't it, Cape Cod? And he says the weather is very nice there.
Actually, it's Martha's Vineyard.
What'd you say?
I said actually it's Martha's Vineyard. It's off Cape Cod.
Oh, I see. Okay, well, and is that far? I mean, I've been to Cape Cod, and I don't know if I've been to Martha's Vineyard. Is that just right close to it, or is it part of it?
It's a ferry ride to get over here.
Oh, it is? Mm-hmm. Oh, I love ferries. That's great. I do, because when I go to New York, one of our major celebrity writers, Darwin Porter, lives on Staten Island. And so I had never really seen the Statue of Liberty so close, but I take that ferry up and back and up and back. It's a wonderful thing. The ferries are very, very good things. And I don't, there's been such high tech in our world, but I don't think that the ferries have gotten involved in that. Have they?
I know. They're still the same old, they still call them a steamship.
Right.
and they but no, you're right. It's not high tech by any means, but it's safe tech.
Yes, it's reliable.
Yes.
Chugs along. No, it's terrific. I think the ferry idea, maybe they bring more ferries around or whatever. But okay, so I said to John, who has been in the healthcare business for a long time, and he's in a very special healthcare business. So why don't you tell people a little bit about United American and give us some of your opinions of what we're hearing.
Okay, well, United American is the oldest Medicare supplement company actually still doing Medicare. They were one of the founding or original companies that offered Medicare supplements when Medicare was founded back in 50-odd years ago. And they've continued to be a leader in the supplement business. Before the policies were standardized, companies could offer whatever they wanted as far as benefits. And a lot of the plans that are standardized now are based on the plans that United American voluntarily did on their own back, before they were told what they had to do. And that makes a big difference. Also, the fact that 90% or more of United American's business is Medicare supplement means it's not just a sideline to the company, but it's a primary or the primary product. So they work very hard at trying to remain one of the best companies out there. And they're great to their agents, they're great to their policyholders, and it's kind of like a great big family in a way. And you asked me about all the healthcare talk that's going on now with all the candidates and everything else. And it's kind of scary. I mean, number one, Medicare was designed for a specific reason. For people when they retired from their work, most of them lost their coverage. This way they had coverage after retirement, after 65, that stayed with them, affordable, designed for what they needed, or with plans available. Doing Medicare for all, as some of them are talking about, would not just bankrupt the Medicare system, it would bankrupt the whole country. Everybody that has Medicare has been paying into Medicare all along. I mean, it's part of it. You have your money that comes out for Social Security and everything else out of your paycheck every week, and part of that goes to Medicare. So people have been paying into Medicare. If somebody started out right now at, I don't know, let's just say 20 years old, they haven't paid anything into Medicare. And if you add all those people up, Medicare for all would be a disaster.
Well, let me ask you a question. Years ago, when they took out Social Security, I didn't know there was something else involved in that. I thought it just was Social Security.
Well, a little bit. There's a small percentage that actually goes toward the Medicare Part A, which is the hospital coverage, or just your basic Medicare coverage.
And that's always been that way. Whenever I paid my Social Security, they always took that out.
Mm-hmm.
I didn't know that.
Yeah, that was one of the initials in the, was it FICA, whatever they call it? But anyway, a small portion, because Medicare and Social Security are joined together, or they were initially. When Medicare first started, it was under Social Security, administered by Social Security, before the Health and Human Services took over. But I think it would be a disaster to the Medicare system and to everybody who wanted coverage if they tried to do something like that. It isn't set up for that many people in that type of coverage.
Well, maybe they have to call it something else and just do something else. But I mean, I think the whole point of it is there are people who just need to have insurance. They just need to have insurance.
I agree.
And so something has to happen that they can get it. And however that's worked, I mean, I don't know what it is, but that's this whole point of, I mean, we're not talking anymore about the deficit. We're not talking about the road work. We're not talking about, I mean, we talk a lot about immigration, but it's health care now. That's the highest and most important issue. And I know when President Roosevelt, I think he was really booed about having Medicare for people or having Social Security, but it has been a great saving grace for people.
Oh, yes. The sad part is I wish Congress would pay back what they borrowed from Social Security, so Social Security wouldn't be...
Exactly.
That wasn't supposed to ever be touched. That was a trust fund.
I know that. I'm so glad that you said that. I've said this to people, and they look at me. Of course, that's what would have taken care of Social Security for many, many years. But they went into it. And
they borrowed, supposedly, but they borrowed without any intention of paying back.
Right, John. Oh, I'm so glad you said this. Oh, I hope everyone who's listening, shaking their head. So now when they blame Social Security, that's not fair.
Right. I mean, how would they feel if somebody went into their trust fund and borrowed against them?
Right. And then said, well, we can't afford it.
Yeah, we can't pay you back.
Right. Yep. I see you said that. And it is a misnomer. People don't ever talk about it, do they? Not really.
No, that's the sad part. They don't.
So when people say that, it's not, we can't afford it, well, put the money back and then we could afford it.
Yeah, because when Roosevelt set it was set up as a trust fund, and it wasn't supposed to be touched ever, except for paying people what they've put into it.
Right. So now, I guess, why did they think they could do that? Did they not need permission? I mean, how did that? I don't know how many years ago did this start.
I honestly don't know, when it started, and I guess just because they seem to be able to do whatever they want there.
Yep.
And it was something that they were trying to find a way to fund something, and they said, "Ooh, here we go."
Yeah, all the money. Why don't we use that and we'll just borrow it, right? So, see, and I don't hear anybody saying that on the campaign trail at all. So now they're trying to find new money.
Yeah.
That's amazing, isn't it? Well, right. And the other part about this is that now they talk about, I guess Bernie talks about it, but that we're going to have two kinds of insurance, or he doesn't say that, but some of the other people say, well, you can also have private insurance along with the other. Well, that's, in a sense, that's why I've been a member of United American for a long time, because I call that private insurance, don't I? Is that what I call it? I should call it that.
It's essentially it is. It's yours. It's your policy.
Yeah.
You're paying for it separate,
Right.
and it picks up after Medicare.
Right.
Originally, when the supplements came out, they were called Medigap plans,
Right.
and that was the government acronym for Medicare gaps.
Right.
And now they're referred to either Medicare supplements / Medigap.
So when
But-
so go ahead.
No, well, I mean, they were designed to supplement and fill in the gaps because Medicare was never designed to cover everything at 100%. There was always, when it was initially set out and still to today, it pays the bulk of everything, but there's still the gaps that, like the deductible in the hospital and co-pays, and if you're hospitalized or need care after a hospital stay, co-pays at the doctors and things like that, and that's what the supplement covers. So that it makes it pretty much that you're covered at 100% when you have Medicare and Medigap.
Yep. Well, must be very interesting for you to watch what's going on.
Interesting and scary at the same time.
I know it is something else, but so let's just talk about this. I did have a question. All right, so let's say people don't have money; they wind up at the hospital, and then they can't pay. The hospitals just eat it, I guess, right?
In some cases, yeah. In other cases, they can get help, or depending on their income, there is some federal help. If it's really low income, or the hospital will set up some kind of a payment plan for them or something if they have to. So.
Mm-hmm. Well, this is, we all know that, and there's nothing like having a small child and you can't afford to go to the doctor, you can't afford to do something. And the other thing that's popped up, and maybe I guess they take United American too, all these little quick clinics, the little healthcare clinics all around. Why did they pop up?
That's a good question. But I think some of them were because if you had an ache or a pain or something, you could drop in there.
Yeah, right.
And maybe not have an appointment or have to wait for an appointment, or maybe if you didn't have a regular doctor,
mm-hmm.
That you were used to seeing, or you could run into one of those quick clinics. I know there were some that I've talked to people who became their only point of that they went to was one of the walk-in clinics. They quit going to regular practicing doctors because they felt like they could get quicker service and things like that. But yes, Medicare does cover if they participate with Medicare. Then Medicare covers everything for the visit.
Yeah. I have never been to one. Have you?
Years ago, there was one in Coconut Creek that I went to once when I had I think it was a fever, and I just wanted to go see if I could get something for it. And it was and it was on a weekend, so I knew my doctor was closed.
I see. Yeah.
So it's just a matter of convenience and not waiting till Monday. But I really know I have a regular doctor that when I need, I go to.
Right, and I think most people do, but I think it's what you said. A lot of times, it's always on the weekend. It seems that something happens, right? And
yeah,
it used to be you could call your doctor, but now many are not taking calls on the weekend. So I guess they either say, well, go to the emergency room or something, right? But you don't want to go to the hospital if you can, don't have to.
Right. I remember when doctors used to come to the house and visit you if you needed it.
Right. Oh, that's true. That's really true. Well, let's keep. I just want everyone to know, though. Let me tell everyone who is speaking. John Ahlbum, Ahlbum, who's owner of the Ahlbum Insurance Group, and he is calling. And they actually have offices here in South Florida, but he's now on vacation, and he's in Cape Cod or Martha's Vineyard, whichever you want to say. And I'm going to give you a number to call, though, his office, because he has his son. He has plenty of other support staff that will be glad to answer any of your questions. The office number is 954-970-4760. Is that correct?
Yes.
Okay, I'll do it again, 954-970-4760. But we have a great surprise for you. Why don't you come to the Boomer Expo, which is going to be held over there at Coconut Creek at the Seminole Casino, and it's on Tuesday, coming up, Tuesday, July the 23rd. And so we hope you'll go there because he will have his support staff there. You can find out what it's all about because as we were saying, there are HMOs, there are other kinds of insurance, but John Ahlbum has been representing United American, which is a supplemental insurance. It offers you a lot more than the other insurances. Yes, you have to pay, but I always feel that, excuse me, and I've been involved in his company for so long as someone who carries that insurance, I never have to think about where I'm going to go, and if I just want to go to a doctor, I can go. And it's amazing, John, how when they all say, well, what kind of insurance do you have? You know, and they look at you, and when I show them a United American, they have a big smile on their face.
Yes, they do, and it's so neat because one of the greatest sources for me all along has been doctors referring people to me, or referring people to United American, because they pay. The doctors feel like they're taken care of, and everything works very quickly for both the doctor and the policyholder. So it works out real well.
Yeah, it does. And I've never had really, I've never had any complaints. I'll tell you only one time I started with a new doctor, and I'm not going to go to her anymore. And I gave her my insurance and everything, and I got billed for $12. I've never gotten billed because either United American accepts it or somebody. And it wasn't a huge, I think they're just tests and all. And I said, how come I'm billed? She said, well, that's the difference. Well, I guess most doctors eat it or something, but that's not why I'm not going to her. It was just a whole attitude, though, that she has. And so I have found another doctor, and I don't think that's going to happen. But,
oh, good.
But because I was going to call you about that and say, why am I having to pay this extra $12? It wasn't the $12, it was the point.
Sure.
Because I usually don't have to pay anything. I guess I'm very spoiled. Although, I pay my monthly fee to United American and all that.
Yeah, you should never have to pay anything extra with a policy that you have.
Yeah, right. Well, that's what I told them. So that's okay. I'm not going back anyway for a lot of other reasons. But so that's, just other reasons that she's just into computers.
By the way, one quick, I'm
Yes.
really not on vacation. I'm working up here as hard as I work back in Florida. Everything's connected. We have a little office here in the house that's connected to their office in Florida. So,
excuse me, I'm so sorry. That's right.
Okay.
You don't get to take a vacation. That's the nice part about life today. You can work from anywhere, right?
yes.
Okay, so take that back, everybody. He's not on vacation. He's working. He does get a vacation, though. He's put in how many years? How long ago did you start Ahlbum Insurance?
28 years ago.
Oh, well, you're allowed a vacation, John. Well, and it's interesting that he has been so busy that he's literally brought his wife in as an agent with him because she was surrounded by all this for so long, and it gave her something to do with you. So how's that working out? The wife and the husband working out okay together?
Oh, she loves it. She loves the business.
And of course, their son is now in the business.
My son Tim is in it, and he loves it.
Oh, my goodness. Well, it was nice. So many times people have businesses that they can't convince their family to be involved with.
Yeah, that's true.
But you have.
Actually, my youngest granddaughter, who just turned 7, likes to come to the office and hang out and says that she wants to go to insurance.
Oh, my. Oh, I love it. Well, that's wonderful. That's really a good thing. So when you, some of the other agents who are friends of yours and that have United American in different locations, has anyone stayed in it as long as you?
Yes. Yeah, there are some other agents that have been there as long as me, or even longer, but not many, but some.
And the United American, I know that, of course, you're in South Florida. Can you sell insurance anywhere in Florida? Can you sell insurance out of Florida?
Yes. The way it works, you're licensed in your home state, and you can sell anywhere there. And then you can get what they call non-resident appointments and sell in any state you're appointed in or licensed in as a non-resident, you can sell. So we're licensed as an agency in about, I think, 27 states.
Really?
Mm-hmm.
And why would you do that? Because people who are in South Florida are really, sometimes they don't just live here only? Is that why? So you can...
Well, more so that if Mary Jones buys a policy from me in Florida and her sister lives in Phoenix, and her sister's turning 65, and Mary was happy with the service I gave her, she refers me to her sister, and because her sister wants to talk to somebody that can help her the way her sister was helped, and by being licensed there, I can go ahead and quote rates and recommend what she should have, and if she wants it, I can go ahead and sell it to her.
Oh, I see.
And do the application.
Oh, that makes a lot of sense, of course, because you're going to get referrals.
Yes.
So, well, now I just got that answer. I never knew that. I mean, I didn't understand that. Okay, so you're licensed in 27 places. That's amazing.
And I also recruit agents in other states, too. If an agent comes to me, they're there. So that in order to have an agent with you, you have to be licensed in the state, too. So.
I see. Well, it's interesting that you talk about this because I didn't, I just thought it's kind of like lawyers. You're a lawyer in one state, and unless you take the bar in another, you don't practice.
Mm-hmm.
Or real estate the same way. The other question I do have is, what do you do anything special for veterans with your company?
Not specifically, but we do have a couple plans that work well for veterans, because most veterans are eligible to get benefits from the VA. But we have a couple of higher deductible plans that if they were unable to get the coverage they wanted or the service they wanted right away from the VA, they still have the option to go to an outside facility or outside doctor, and this will pay, after the deductible, will pay 100%.
Oh, really?
But by having the higher deductible, they're paying a very minimal premium, so that they're not. They can either use the VA or they can use outside facilities. Mm-hmm. And a lot of them are very happy with it, because if something does happen or they want to see a specialist and they can't get an appointment right away through the VA, they can still go, and have it taken care of.
I see. Okay. That's very good. Yeah, that's what we want to do. So.
And we do help them, if they are a veteran, we help them wherever we can with their prescriptions, because they can get, most of their prescriptions through the VA. So we recommend that, help them with, researching that and finding out, making sure that it's price-wise, that it's, what they're getting through the VA is cheaper than they could get on the outside and stuff. So
Right. So what you're doing is you're actually acting as a good Samaritan citizen to help people.
Mm-hmm.
And then,
yes.
yeah. But now veterans, of course, Bill was a veteran and he had a policy. So they can still have policies. But, sometimes people just are so used to just going to the VA. And I guess if they do that, they don't need a separate insurance policy, do they?
No, they don't. The only problem, and I've had veterans who said, I plan to do the VA, but I found out that if I want to go outside the VA, I have to write to Birmingham or something and wait till they give me permission to see a doctor outside the VA.
Right. That's true. We know about that. Well, John, I don't want to take away from your lovely business up there.
Okay.
But we thank you so much, John Ahlbum, and I'm going to give you the phone number for the company again. Remember, come to the expo, and you can talk to his representatives, but you can call their office, which is 954-970-4760. John Ahlbum, AHLBUM, great insurance company, United American. Thanks so much, John. Say hello to your wife for me.
I sure will. Thanks.
Okay, thank you, John.